An injury to the Achilles tendon in your ankle can cause a lot of pain. Physical therapy and ultrasound and other conservative treatments are usually tried first.
But if the pain doesn't go away, surgery can be an option that can get you back on your feet. Shelley Botat has more in Health Watch.
After years of suffering, Chris Behrens couldn't live with the pain in his heel anymore. So a local doctor got him back on his feet again, pain-free. Chris Behrens is back at the gym 5 to 6 days a week.
A bit on the treadmill. I'm back into the resistance and weights routine.
Chris started playing tennis as a teenager and even played in the U.S. Tennis Association. Later, he stayed active but was dealing with pain in his heel.
Which basically prevented me from running or doing hiking.
But Chris was told surgery wasn't an option. Then last winter, he fell on the ice.
My heel came down, smashed very hard on the sidewalk.
And the pain in his right heel got worse.
Walking any extended distance was very difficult as well.
So he was referred to Dr. Brandon Scharer, an orthopedics foot and ankle surgeon at Aurora BayCare Medical Center. Dr. Scharer found that Chris had actually injured his heel years before and had been living with a chronic traumatic injury.
And at some point, he partially ruptured or tore the tendon off the bone.
Chris was diagnosed with insertional Achilles tendonitis, which created extra bone growth.
Is that it creates this prominence, and that prominence creates pain towards the back of his shoe.
In the past, Chris had tried therapy and foot wraps to combat the pain, which didn't work. So Dr. Scharer recommended Achilles debridement repair surgery.
We made an incision, and we took that tendon and reflected it back so we could gain access to that loose bone and those fracture fragments, removed all that. A lot of times with these tendon, in particular in his case, the tendon becomes thick and it requires debriding or removing that bad or non-viable tendon.
Dr. Scharer also removed the bone formation, and then the tendon is reattached.
I think Chris's surgery went well. He's obviously doing better than he was prior to surgery.
After several months of recovery and physical therapy, Chris is back to doing what he loves.
We just had a very nice driving vacation, the Great River Road, and we did some hiking in the various state parks.
After surgery, Dr. Scharer says most patients are commonly back to 100% or close to it. To learn more, you can call Aurora BayCare or email HealthWatch@aurorabaycare.com. And that's